fight is far from over. Our nation and our city are still very much in the midst of this pandemic. From January 1, 2021 through this very moment, there have been 9,371 COVID-19 cases and 172 deaths among Baltimore City residents. That is 172 of our neighbors, friends, and family members taken from us from COVID in this calendar year. We cannot express this enough that we must remain vigilant every day, every hour, in everything that we do. Now is not the time to let up. On the eve of St. Patrick's Day, I'm calling on residents to consider the safety of your neighbors and loved ones. We have consistently seen spikes in COVID-19 cases following holidays where people get together. I know the weather is nice, and we are all anxious to be together and to be out, but the pandemic isn't over. Don't let the thrill of a good time harm your health or the health of someone you care about. Please avoid large gatherings, practice physical distance, and continue to wear a mask. Better said, be responsible. Think about tomorrow, think about next month, think about the rest of the year and the rest of your life that you want to have. It's not the time to go bar hopping. It's not the time to be reckless with your personal activity just because the weather is better in the St. Patrick's Day weekend. We know that can lead to the lives of people dying. You can literally kill someone that you love by being irresponsible. And now I'm going to turn it over to our Health Commissioner, Dr. Jaraza, to give us an update on our most recent data. Dr. Jaraza.
Good afternoon. Thank you, Mayor Scott, for your leadership during this pandemic, and thank you to our partners joining us today. I'd like to briefly share the data on key COVID-19 metrics in Baltimore City. As of this morning, we have lost 811 lives to COVID-19. We have had a total of 41,395 cases in Baltimore City residents, and our latest 7-day average new case count is 93 cases per day, a 12% decrease from 4 weeks ago, but a slight increase from last week's average of 92 cases per day. Our latest 7-day positivity is 2.2%, a decrease of 24% from 4 weeks ago, but a slight increase from 2% positivity last week. Our hospital utilization rates have slightly increased, with intensive care units at 84% and acute care units at 88% capacity. Fatalities due to COVID-19 are now averaging at about 1 death per day, a 53% decrease from 4 weeks ago. As of this morning, the Baltimore City Health Department and our healthcare partners have reached 15.3% of the city's population with at least the first dose of the vaccine, which in total is 90,978 Baltimore City residents. 51,569 residents have also received their second dose. As always, all of this information can be found on our public dashboards at coronavirus.baltimorecity.gov. To summarize, what we're seeing right now could be described as a plateau or flat line of our case data. We made significant improvements from our case counts, fatalities, and hospitalizations compared to where we were in December. However, we've seen some fluctuations in the data just this week, and after a year of witnessing ups and downs in data trends, we remain consistent in our certainty that time is needed to determine the true direction of these trends. As we have consistently stated throughout the pandemic, our strong preference is to have at least 4 weeks of data before implementing new restrictions or removing old ones, and we will be on track to seeing where things stand by early next week, as March 22nd marks 4 weeks since we implemented the latest changes to Phase 1 restrictions. The majority of vaccinations provided in the city so far have been Pfizer and Moderna vaccines. As a reminder, these are both 2-dose vaccines, with the second dose of Pfizer being administered at least 21 days after the first dose, and the second dose of Moderna being given at least 28 days after the first dose. CDC guidance states that you can wait up to 6 weeks or 42 days between doses. However, we strongly encourage residents to stay within that 3 to 4 week period as much as possible. We're pleased to report that according to Immunet data, of those city residents eligible for their second dose, 91% of residents total, and 88% of our residents over the age of 65 have received their second dose. However, in reviewing the data, approximately 2% of city residents that have been vaccinated almost 1,800 individuals have not been documented as receiving their second dose yet, more than 6 weeks after receiving their first dose of the Pfizer and Moderna vaccines. This is a concern because unlike the Johnson & Johnson vaccine, both doses of Pfizer and Moderna vaccines must be given for the vaccine to be fully effective. Please, if you have received your first doses of either Pfizer or Moderna, make sure you have your plan to get your second shot. We know that 44% of those who have not received their second dose after more than 6 weeks are adults over the age of 60, and we encourage everyone to check on your older relatives who have been vaccinated to ensure that they have a plan to get their second dose. In order to ensure equitable and rapid vaccination of city residents, the Health Department is continuing to work with healthcare partners to direct doses to older adults, city educators, first responders, and people experiencing homelessness. Beginning next week, we will also be supporting continuity of government operations. Next week, we will be utilizing our doses in the following manner. 750 doses will be reserved for Baltimore City residents over 65 years old, city educators, and individuals supporting continuity of government operations at our closed pod site at the Baltimore City Community College. 1,150 doses will be reserved for clinical partners operating closed pod sites serving Baltimore City older adults from our Maryland Access Point list, as well as city educators. This allotment includes supporting the vaccinations at a new vaccine clinic in partnership with the University of Maryland, Baltimore. We are pleased to have UMB as a new partner, and John Bratt, the Executive Director of Emergency Management for UMB, will be joining us shortly to share a few words about this new option for vaccinations here in the city. 1,000 doses will be reserved for our mobile vaccination clinics, serving older adults living in senior housing sites and individuals experiencing homelessness living in congregate living settings. The Health Department is continuing to scale up its successful mobile vaccination clinics alongside our healthcare partners, using the city's allocations of doses to bring vaccines directly to our older adults living in senior housing buildings and residents living in temporary housing. This week, we are pleased to report that we have held 20 mobile clinics to date and provided 2,000 first doses of vaccines directly to city residents through our mobile testing teams. We are grateful for our partners at MedStar Health, Johns Hopkins Health System, Johns Hopkins School of Nursing, LifeBridge Health, and Safeway, who have all played a vital role in reaching the city's older adults and housing insecure residents where they are as a part of our mobile vaccine clinic program. The number of mobile clinics we can host is dependent on our weekly vaccine supply. And next week, working with our partners, we will be visiting the Hollins House, Rosemont Towers, Apostolic Towers, St. Mary's Roland View 2, and Renaissance Garden Apartments for first dose clinics. We will also be returning to Harlem Gardens Senior Apartments and the Morrell Park Apartments for second dose clinics. Additionally, through partnerships with the Lord Baltimore Hotel, we will be hosting vaccination events for those living in temporary housing at the Recovery Center of Maryland, McVet, and Pender Hughes Shelter, as well as a second dose clinic in partnership with Healthcare for the Homeless at the Weinberg Housing Resource Center. Testing for COVID-19 remains a vital component of the overall pandemic response, and we still encourage residents to get tested if they're experiencing symptoms suggestive of COVID-19 or have been in close contact with someone experiencing symptoms of COVID-19. Our mobile testing clinic schedule is posted weekly on our social media accounts and on our website, coronavirus.baltimorecity.gov/testing. Additionally, please remember to pick up the phone when MD COVID calls, as our contact tracing program remains as vital as ever to quickly identify and reduce disease transmission. As always, please continue to wash your hands, wear your mask over your nose and mouth, and reduce your contact with others to slow the spread of disease. Baltimore has weathered this pandemic and has remained relatively safe because our residents understand the nature of this disease. We wear masks, we keep our distance, and we are getting vaccinated. Now is not the weekend to throw away a year's worth of best practices. While we all miss our friends, our families, and parties, this year's St. Patrick's Day celebration should be held at home or in small groups to reduce the chances of disease transmission, reduce the burden on our hospital system, and to save lives. Thank you.
Thank you, Dr. Geranza, and the entire team at the Baltimore City Health Department for your life-saving and many times thankless work over this last year. I want to now recognize John Bratt, Executive Director of Emergency Management for UMD, to say a few words about our new partnership. Mr. Bratt?
Thank you, Mayor Scott. Since the beginning of the pandemic, UMB has strived to meet its mission of improving the human condition and serving the citizens of Baltimore. As an anchor institution, we could not think of a better use of our talent and resources than to build vaccine administration capacity right here in our backyard. I'd like to take a moment to thank our partners for making this effort possible, including the City of Baltimore Health Department, the Maryland Department of Health, and the University of Maryland Medical System. And of course, the faculty, students, and staff of the University of Maryland, Baltimore, who have served countless nights, days, and weekends to make this effort possible. I'd like to also thank this. We are excited about our continued partnership with the City of Baltimore and look forward to administering vaccine to those who need it most in the city and look forward to meeting that need. Thank you again, Mayor Scott.
Thank you, Mr. Bratt. As we have done throughout the pandemic, Baltimore will continue to evaluate the data on a regular basis to determine the path forward. Next week will be our 4th week of our current mandates. The Health Commission and I will provide an update next week regarding our plans moving forward, sticking to our original plan and course. Now, before we switch gears, I want to give the most important voice in our pandemic, our doctors and public health professionals, an opportunity to say a few words about our continued COVID efforts, if they would like, Dr. Sharpstein and Dr. Margakis.
Thank you so much, Mayor Scott. Thank you so much, Dr. Jaraza. It's great to be here. I'm Josh Sharpstein from Johns Hopkins Bloomberg School of Public Health. You know, when this pandemic started, people had in mind the places that would probably be hit the hardest in the United States. And we saw cities and regions kind of move into the forefront, be the headline cities of where there was just a tremendous amount of COVID. And if you look back on the last year, Baltimore has vastly exceeded expectations. There were many reasons why people thought that Baltimore would be one of those cities that was just disproportionately devastated by COVID, and it has not been one of those cities. And you think back for this year, why is that the case? And a major reason are the two people who are behind me, Mayor Scott and Dr. Jaraza. The city worked collaboratively with the University of Maryland and Johns Hopkins right away to set up a call center, to set up safe housing for people, to provide testing, to provide mobile testing. And that spirit has carried through a number of announcements and policies based on evidence, the tremendous dashboard that you've seen. And I just think it's important to take a little bit of the broader picture and realize that Baltimore has gotten to this point as a city with great leadership, great partnership, and great response by the citizens of Baltimore. And personally, I want to thank Dr. Jaraza particularly for her just tremendously steadfast leadership in this incredibly challenging situation, just, you know, extraordinary moment in time. And the way that Baltimore has managed this is, if you take an analogy of a boat moving towards safer waters, the city has had its hand on the tiller, and it has been steering the ship based on the best data available to get to a better place. And this is not the time to take your hand off the tiller. This is not the time to completely, and I like the translation of that too. This is not the time to act as if that COVID is no longer a challenge. It is a deadly challenge, and it is exactly by thinking methodically, basing on data, and talking optimistically about the fact that we are headed towards a much better tomorrow if we can stick together today. Thank you very much.
Thank you. I would like to add my thanks to Dr. DeRaza and to Mayor Scott for their leadership and for keeping the city safe through this extraordinarily challenging time. I think that I would just echo the words of hope that you've heard here today. We see vaccinations advancing quite rapidly, and Johns Hopkins is very pleased to be a partner in the public-private partnership in order to serve the community and to vaccinate our residents and keep everyone safe. I would just, as an infection prevention professional, add a note of support for all of the infection prevention measures that we are now all so familiar with: masking, physical distancing, and avoiding indoor gatherings, particularly large gatherings. And to say that these have worked. They have worked to keep our city safe. And in addition to the SARS-CoV-2 virus, we have seen great success in almost elimination of influenza this year. So let's persevere as the weather warms and some of the holidays and spring breaks come. Please keep going and hold on for a little bit longer while vaccinations roll out and we can see brighter days ahead. Thank you so much.
Thank you, and thank you all for being here and for your great work. We have all had to make major adjustments to our lives during this pandemic, but I want to know that everyone to know that I greatly appreciate every resident, healthcare worker, frontline employee, teacher, and everyone who has gone above and beyond to show and do their part in slowing COVID-19. Your efforts have kept our city going through these unprecedented times. Although the latest trends in public health data are promising and more people continue to get vaccinated, Baltimore is not in the clear yet. Our country and our world is not in the clear yet. We must stay the course and make responsible decisions on behalf of ourselves and those around us. Keeping with the theme of responsibility, not only must we do our part in fighting the virus, we also must do our part in coming together to reducing violence in Baltimore City. Commissioner Harrison and I have stood before you multiple times to talk about the extremely high levels and unacceptable levels of gun violence in our city, what we have experienced over the past year and recent weeks, and especially involving our young people. I want to give the Commissioner a few moments and an opportunity to give a few updates before I come back to the podium. Mr. Commissioner?
Good afternoon, and thank you, Mr. Mayor. Over the past 2 weeks, our department has been working very aggressively to identify those responsible for the violence in our city, especially incidents involving our young people. We have now made several arrests, to include a 14-year-old and a 15-year-old who targeted and shot 2 of their peers following disputes. Our detectives comb through evidence, they comb through leads and tips from the community to bring these individuals to justice for these senseless acts of violence. We must continue to work together every day to disrupt the cycle of violence that's tearing our communities and our families apart, including and especially our youth. The violence and the lack of regard for human life, or those who could be caught in the crossfire, is simply just truly unacceptable. We're continuing to be laser focused on those responsible for the violence in our city and those who are entrenched in this culture of violence. I am committed to using every resource and working alongside all those in Baltimore. I want to thank every member of the public for providing tips and information to help us bring justice to those who are causing harm in our city, and to our detectives that are working around the clock to identify and apprehend those who are causing that harm. Together we'll reduce violence in all of our communities. Thank you.
Thank you, Mr. Commissioner, and let me thank the hard-working women and men of BPD who have been able to bring some sense of calm and closure to families, and we know we have a long way to go. But I also want to say again that we're going to continue to push. They know that we're going to continue to push them to be better, but we also have to be better as a community, especially when it comes to the lives of our young people. This is what you hear me consistently talk about. We're talking about incidents that there are multiple lives and multiple families of young people that are being destroyed. And we can no longer accept that, and we all have to work together to improve that each and every day. And now with that, we will take a few questions.
What do you say to the people who, the many customers who will likely leave Baltimore this weekend to enjoy themselves economically? What does that hurt like for the city?
So listen, this is about, we know what this is about. We know that we've been here before. This is about public health. This is about the data. We know what happened during the last holidays. We saw the spike. We want people to be responsible. This is not like before when our places are closed. They can still go to them. They're just at reduced levels. We're going to continue to push. We are very excited about where our numbers are, but we have the best numbers in the state because we have stayed the course. We have the lowest positivity rate. We have less and less people dying. And I think it's time for us to talk about that just as much as we talk about why our rates are different and our percentages are different than other places. Dave?
For the commissioner, can you tell us how many Baltimoreans, percentage-wise, have been vaccinated? I know you gave the breakdown of how many, but like percentage-wise that have received both vaccination, both doses.
It was a little over 51,000. So that total number I gave you also includes a small amount of J&J vaccine. So I'd like to just go back and check with the team. But a little one over 51,000 have received that second dose. Total, at least 15% of the population have received a first dose of either J&J, Moderna, or Pfizer.
And I know in the past, both the mayor and the commissioner, when you talk about the 7-day positivity rates, you want it to be below a certain number. You mentioned 2.2%. What number do we need to be at specifically to see the loosening or reopening of the loosening of restrictions?
So we've always weighed multiple data points when we're looking at making restrictions. One of the things I think that Mayor Scott has talked about is a need for us to observe the data over a 4-week period. So you can go to our dashboard and see our reopening metrics and indicators, which includes positivity below 5%. It also includes new case rate. It also includes hospitalizations as well.
And just one other thing for the mayor. Today the Orioles announced the 11,000. Can you please address that? Because I imagine once they have that home opener, that will impact possibly positivity rates.
Well, as it was said, Dave, and I want to get to both of your questions. As it was said in their press release, this is something that I support. The health commissioner walked and worked with the Orioles to make sure that they were doing the right thing. The Orioles are doing the responsible thing. And when you look at them in comparison to teams around the country, you can see that they are a team that's rooted in their community, that they have ownership that's rooted in understanding this moment that we're in, and that they want people to be able to go to Camden Yards and celebrate our Orioles. There's nothing more in the world of sports than I want than an Orioles World Series championship and for me to be there. But I also want people to be there in a way where they're healthy and safe. So we fully support them. We know that they have practices and protocols in place, and they will consistently work with Dr. Jaraza and her team to make sure that they're doing the right thing moving forward, and we have the fullest expectation that they will. And to your other point, Dave, about the testing, the positivity rate and the numbers, I also think it's important for us to recognize that even though our numbers are significantly down over the last month and the last few months, we're still a lot higher than we were months ago, September, all of those months. So we have to think about it not just in that closed time space, but in the largest time space of this whole year that we've been in COVID as well. Sorry, I didn't see you. Go ahead.
Thank you. Mr. Mayor, this can be for you or for the health commissioner, or frankly anybody in the public health sphere. Obviously, I know you can only control Baltimore, but every county surrounding Baltimore opted to go along with the governor. I guess what kind of challenge does that present to you in terms of keeping the people of Baltimore safe from the virus? You know, it's been said that the virus doesn't know borders or city limits or anything like that.
I'll let Dr. Jaraza respond in a second, but I think that, as I said earlier, We have had further restrictions than other places before, and guess what? We've had lower positivity, lower cases, lower deaths, and we have to understand that connection. My expectation is that Baltimoreans will be responsible as they've been throughout this. We know that there are other jurisdictions in the state that are not going exactly what the governor is doing, and it's about making sure that we're doing what's in the best interest of Baltimoreans. And again, considering that we have 11 hospitals here, and when people get sick in those other places, guess where they end up? Here.
Hello.
Alexa?
I hear what you're saying about the 4 weeks. Which metric specifically is not where it needs to be to make any changes to restrictions?
So, Alexa, it's not about where they are today. We set a time frame for you guys, and we let you know what the time frame is, and we haven't veered from that before. We've been consistent. Folks have asked for consistency, and that's what we have been doing. We are looking at that data every day. We'll be talking over the weekend and at the beginning of next week, and then we'll come back to you guys and say, this is where we're going. But I'll let the Dr. Deraza talk specifically about all the metrics. But you can see, it's for the world to see right at coronavirus.baltimorecity.gov, where they can see our reopening metrics and where we are.
So as Mayor Scott mentioned, again, we wanted to look at the data over a period of time, and we selected 4 weeks because that's usually when you can see a response, whether it's an increase or a decrease in cases. We have seen a slight increase in cases and really are seeing pretty much a plateau, like it's not continuing to go down. A few weeks ago, our new case rate was falling. We've been at a plateau now for the past week and a half or so. So we're not continuing to see that decreased trend that we were seeing at one point. Additionally, we've seen a slight uptick in hospitalizations. Again, we'd like to see this number come down consistently as well. So again, all those metrics can be found on our dashboard, coronavirus.baltimorecity.gov.
So I'm hearing hospitalizations not quite where you'd want them. What was the first one you said?
New cases per day.
Got it, okay. I have a question for the commissioner, if that's all right. Hello. Hello.
Good afternoon.
As we've seen your department report the young people who have been charged with crimes against other young people. As commissioner, what does that tell you that the city needs to do?
Well, it talks about, you hear me say this all the time, it's the culture of violence. We have to change the culture. The reason why people think they need to, number one, get their hands on a gun, and number two, solve their conflicts with violence and with guns. We have to change both of those things. It has to be with consequences, but we have to change the way they think and the way they think they have to solve their conflicts. And it really speaks to conflict resolution, which is a problem that schools, homes, churches, nonprofits, police department, all of us, families, we all share in that responsibility to change how our young people think about dealing with conflict.
And that's the question I keep hearing is, where does a 14-year-old get a gun? Where does a 15-year-old get a gun?
Those are questions that we as a city and the police department are asking, and we're preparing to do research and to investigate and to the extent that we can, prosecute those cases. Where guns are coming from, how they end up in our city, into the hands of not just young people, but anybody, and also people who have the willingness and brazenness to use those guns to solve their conflict. In all of these cases, they're people who know one another, people who are either acquaintances or friends. All right? Thank you.
And Alexa, to that point, I just want to say before we close, I think that you were there actually. This is why we announced what we talked about with gun trafficking and the new initiative that we have. We know again that 63% of the weapons recovered by BPD last year came from outside of the state of Maryland. 82% of them came from outside the city of Baltimore, and we have to start to target those people as well. We cannot just think that we will and continue to focus on the people that are pulling the trigger, but we have to figure out if someone is careless enough to let a gun get in hand in a 14 or 15-year-old, that person deserves to be looked at from a law enforcement standpoint too. Thank you. Dave, last question. Go ahead.
This is for the commissioner. Commissioner, yesterday I know the deputy commissioner announced the Lombard incident and the misfiring. When you guys gave that presser on scene, you had said that the gun misfired, and it appeared that that is maybe perhaps what had caused the officers to. But could you clarify from your standpoint when you found out that it misfired, because there was a little question about whether
Yeah, it's terminology, difference in terminology. What we understand from looking at a photograph of the gun as it was recovered, one of the bullets did not enter the chamber, but rather was stuck between the ejection port. And so it appeared that the young man attempted to fire the gun, but the bullet did not enter the chamber, but rather entered the ejection port.
But when you say fire the gun, do you mean at the officers at that time, or do you know if he attempted to pull the trigger when those officers?
That's part of the ongoing investigation.
But
we
you
do not
know.
we do not have the answer to that specific question at this time.
Thank you, everyone.